Hey guys, Dr. Berg here. In this video, we're going to talk about how to relieve SI joint pain. What does SI stand for? Sacroiliac joint. Okay, so now you have the pelvis right here, right? And then we have two little joints right there. So if we look at the back part, we got this thing called the sacrum, which is the foundation of your pelvis. And then we have these two little bones right here that are called iliums, okay? So we have sacroiliac joints. So they move right back here. You got two of them, and that's where they're located. Okay, so what I want to talk about, there's three different causes of sacroiliac joint pain. The most common one, which I'm going to give you a demo, is referred pain. So the pain in this little joint could be referred from, if it's in a female body, the ovary. The ovary, if there's a cyst there, if there's a problem there, it will refer pain exactly right behind to the back part, okay? And if that's the case, I'm going to show you a really simple little test to see if that is the problem. And if it turns off the pain, then we know there could be a problem there, and you just need to add a little sea kelp. Sea kelp has iodine. Iodine reduces estrogen. It helps with cysts in the ovaries, and that usually resolves it pretty nicely, okay? So if it's referred pain, and it's not coming from the, you never hurt your back, the whole thing, and especially if it happens that time of the month, we know it's going to be the ovary. I've had a lady come in the office, and her ovary, it was blowing out the SI joint, and it was causing the joint to misalign. So I sent her to the doctor for an ultrasound. The ovary was the size of a lemon. It should be the size of an almond. Okay, it swole up. And that pushed pressure all the way back there and throughout her back on that side. So we gave her some sea kelp, and the thing started shrinking more and more and more over time, and all the pain went away. Now, in a male body, they don't have ovaries, okay? But they do have these little tubes that come down from the kidney, and they're called the ureters. They're just basically tubes from the kidney to the bladder, and a lot of times they might have a little bit of a stone or a little calcium deposit or a uric acid crystal right into that little tube where it connects to the bladder. So if that's the case, I'm going to show you how to test for that. Ovary is located right here, okay? So you have the hip right here, it's lower. So what you want to do, let's say pretend the pain is on her right SI joint. She's going to press into the ovary on the same side. So just take your fingers and just kind of press and massage gently into that ovary, okay? She's going to do that for maybe 15 seconds. Now what's going to happen? Either the pain in her back is going to go away or it's not, okay? Okay, relax. If the pain goes away, then we know there's a connection between this and her back. And if that's the case, we're going to recommend sea kelp, okay? I have my own version from Iceland. It's organic because it's real pure. Or you can just find another one that's equivalent, but the estrogen needs to come down to help any cyst or anything going on in the ovaries. So if it was on this ovary, you would do the opposite side on that, on this side here. So you would do this side right here, okay? So that's how you would do it if it's referred. Now in a male body, let's pretend that you're a guy, what's going to happen, you would press the same spot. And what that is, the kidneys are right here, and it connects with the tube down into the bladder. There's going to be a little point right there where a lot of times a uric acid crystal or a stone might just sit right there and irritate and refer back to the SI joint. So again, you press right there. If the pain goes away, then we know there could be some junk there that you need to take some potassium citrate. That's what you need to get, and you can get it as a supplement anywhere. It's really simple. It's really inexpensive. You take it, and that will be great for dissolving any stones that you might have. Because one of the things that, if you're on the ketogenic diet, you may start being more susceptible to kidney stones. But potassium citrate is the antidote, and it's really good to take, especially since potassium, you lose your potassium when you go on a ketogenic diet. So, especially if you don't eat enough vegetables. So that's what we want to retain there. Now, if you have the actual joint pain, then I'm going to show you how to deal with that. You're basically going to press. You're going to need someone's help, but you can actually do it if you have a tennis ball. Let's say you hurt, let's say the problem is not being referred, it's actually coming from the joint, maybe because you sit, the sideways or something like that, and you just have some inflammation there or an injury, whatever. Then what you do is if you hurt on the right side, you lay on your back on a tennis ball on the opposite side. So if she hurts on the right, you could have someone massage on the left and work that out and work out the muscles that are connected to the SI joint. And that would be the glutes and these muscles up here. She could be laying on her back with a tennis ball right here and putting pressure on the opposite side, okay? So if the pain's over here, you press on the opposite side. If the pain is over here, you press on this side, and that's the way you get rid of pain in the SI joints. And the last technique is if you fell on your tailbone a long time ago and you smack your tailbone and the force travels up to the spine, up in the back of the neck, what happens, the whole spine becomes very rigid from that point on, and because there's a little, it's kind of like saran wrap, it's called the dura, that's on the inside of the spinal column, that thing gets tight and it can pull and keep one of the sacroiliac joints tight, or even the lower back. So it could come from that. If that's the case, I'm going to show you how to correct that. There's a certain stretch on that. So let's go ahead and do the demo right now. So check this next part out. Now, if someone fell on their tailbone, the force hits the tailbone, goes right up to the back of the skull right here. And so what you want to do, and you're going to need someone to do this on you, but to get rid of a tailbone injury, we actually work on the neck part, okay? So what you want to do is you want to take the back of the neck, and I have my finger attached here, and we're going to stretch. I'm lifting up on the back part, and I'm pushing down on my hand, kind of like taking a basketball and rotating it. So we want to take the finger gently underneath the skull, lift up, stretch up, and then flex down, okay? Making sure that we're not pulling our hair. And then we're going to stretch this about, I do it like 7 times, okay? And then I'll also do the other side with my thumb, and I'll come and I'll lift it up this way. And I'm just lifting the skull up and stretching forward and trying not to mess up her hair, which is the most important thing. Okay? And what you're going to do is you're going to create this space. That's going to release the tension all the way down to the SI joints, and the back will feel like it's tingly and warm and like the circulation. It's a great way to handle an old injury from the tailbone. So go ahead and apply this. Put your comments below.